My name is Dr. William Rassman. I've been in the hair transplant field for 27 years. When I started this business, the hair transplant plugs were the standard of care, and I think I had a major role in changing that, introducing small grafts, follicular units in large sessions, and then eventually follicular unit extraction, and the hair transplant robot with my partner, Dr. Pak. So we've been around for a while. We've done over 16,000 surgeries since we formed this business. We had offices in different parts of the United States, but now we contracted the business more to California, although we get a lot of referrals from elsewhere. I met Dr. Gino Kim probably more than a decade ago, and we've been friends ever since. He came here, and although he knew how to do hair transplants, he spent a month training with us, brought his staff who stayed beyond his stay to learn all our techniques, and then took the slit technique that we were using and moved it to Korea, and may be one of the few doctors using that technique today. There's very little difference between NHI Korea and NHI California. The techniques are the same, the skill of the surgeons are the same, the staff use the same techniques, whether it's SMP or hair transplantation or FUE, everything is the same. We share knowledge with each other, which is very important. When we come up with breakthroughs like the easy grafter or a new punch for the FUE, we share those experiences together, and if one adopts it, then the other will adopt it. So there really isn't any difference between NHI Korea and NHI California, excepting our climate, which is better here in California than Korea. The future of hair transplantation will continue to be a good future. Patients can get it done in 1 or 2 sessions most of the time, and then go on with their life and not come back over and over again, which is very important. There will be more breakthroughs coming in the hair business, hair restoration business. They'll come from medications that are on the horizon. In the next 5 or 10 years, we will see major changes in the way we deal with hair loss. It may not be for the very bald person, but it may affect the people who are just starting to bald. So it's a very bright future because of our connections with researchers from all over the world. We will probably be at the front end of those changes, and whatever we do in the United States, in California, will be done in Seoul, Korea. We have a new implanter for hair transplantation that I think is superior to the other implanters that are on the market. It is easier to use. You can train a technician on how to do it in under 30 minutes. It's totally disposable. Many of the implanters that are being used are not made for throwaway use, or rather they shouldn't be reused, but they are reused because they're expensive. So our implanter is very inexpensive, and it's very cost effective to use it and throw them away, and that will make it a better implanter in the long term with greater patient safety factors because it can't be reused or re-sterilized. I've had the opportunity to visit NHI's facility in Seoul, Korea, and I've seen Dr. Gino Kim in action. I've met some of his patients after surgery. You cannot even tell any of them ever had surgery, much like our patients. There really isn't very much different because we are pretty much doing the same technology, and I think that's what distinguishes us from everybody else in the field. I think also the fact that we've been doing it a long time gives us one edge up on many people, because experience, there's no substitute for experience. And that is really critical to the success of any transplant.